Hello, my name is Tammy Grimes, and this is my video assessment for Module 4, Eyes and Ears. This is my patient Haley. She's my 16-year-old daughter. She does wear corrective contact lenses. She is a negative 4.50 in the left and a negative 4.25 in the right. She denies any pain or itching to her eyes. There's no redness or drainage noted. When performing her distant visual acuity test with the Snellen chart, she scored a 20/20 on her right and a 20/20 on her left eye. We did the near visual acuity with the near vision card, and she scored a 16 out of 32 to the right and to the left. Peripheral vision testing was performed with the confrontation test and was within normal limits. Next, we will do the extraocular eye movement testing by having her follow my finger, keeping your chin straight. Just use your eyes. We're going to check the movement of the eyeballs in all 6 fields. And as you can see, all her movement is within normal limits. Balance of extraocular muscles was tested with the corneal light reflex. This is done by having her look at a nearby object and then shining a light to the bridge of her nose. The light reflected in her eyes should be symmetrical, and it was. If there was an imbalance, then we would perform the cover-uncover test. Now we will inspect the eyes for lesions and skin tags. Close your eyes for me. And her eyes look good. Eyebrows are evenly dispersed with symmetrical placement. When asked to close her eyes, there are no tremors. Blinking reflex is intact. The eyelid covers a portion of the iris but does not cover her pupil, so it is within normal limits. Her lacrimal gland and ducts appear within normal limits. The next thing we're going to do is check her conjunctiva by having her look forward. I'm just going to gently pull down the bottom of her lid. It is pink and moist on both eyes. The sclera is white and normal. There's no lesions. Corneal sensitivity can be tested with a wisp of cotton touched gently to the cornea. However, she does wear contact lenses, so she's not very sensitive when this test is performed. Her irises are blue and round and equal in size. Her pupils are about a 3 millimeter, and they're round and they do react briskly to light. Her ophthalmoscopic exam revealed the red reflex, which is normal. Moving to the ear, she denies any trauma, no tinnitus, no ear infections, no hearing loss. The earlobe is the same color as the skin of her face, so that is normal. Placement of the ear can be checked by drawing an imaginary line from the inner campus of her eye out. And then you can see that the auricle of her ear is either at the line or above the line is within normal limits. And hers is above, so she is within normal limits. The earlobes are detached, and that is normal. She does have normal skin folds in the ear. Sometimes you'll see like cauliflower ear on wrestlers and things like that. She don't have any of those issues. She denies any tenderness when touching her ears, and there's no pain or swelling. Upon her otoscopic examination, when we look into her ear, can you tip your head slightly? We can see her membranes are clear and it's within normal limits. The whisper test can be performed. I'm going to have the patient cover her opposite ear. I'm going to whisper approximately 2 feet away from her, and then I'm going to ask her what I said. What did I say?
You are beautiful.
Okay, so she passed, and then we would do the same thing again on the other side. A Ryan test can be performed to check whether the person hears better by air or bone conduction. To do this, you take a tuning fork, and you're going to touch it to the mastoid bone, and then ask the patient to tell you when the sound is no longer heard. You'll time that interval. Then quickly move the tuning fork 1 to 2 centimeters from the auditory canal, and then ask her to tell again when she no longer hears the noise. And then the air conduction should be heard twice as long as bone conduction.
Oh, here. So, not
As you can tell, she obviously heard that twice as long as the mastoid, the bone conduction. This concludes my assessment for this module. Thanks.